name is Castra and I'm a registered physiotherapist with Med Rehab Group. Well, generally for recent injuries we use a general protocol referred to as R.I.C.E, which stands for rest, ice, compression, and elevation. So to demonstrate the R.I.C.E principle, we will use a mock ankle sprain. So we have Ashley as our model. So we're going to say that she recently had a outside ankle sprain, so recently. So a lot of times with ankle sprains, the foot and ankle are turned inwards, causing pain and swelling on the outside. So the first part of the R.I.C.E principle is rest. So with any injury, you want to rest it in as comfortable a position as possible. So in this case, she can be long sitting or lying down. And then just for comfort, she can rest it on a pillow. The second part of R.I.C.E is ice. So with icing, there are a couple things to remember. Ice can be in different forms, either a gel pack that is kept in a freezer, or you can make a homemade ice pack by putting ice cubes in a Ziploc bag and crushing it. Ice pack should be placed in a pillowcase or a paper towel to insulate it. And the ice pack should be applied just to the outside of the ankle. So in this case, we said it was a sprain to the outside, so a lot of pain and swelling occurs here. So you just want to place the ice pack in and around here. Ice should be kept on for about 15 to 20 minutes and should be checked every few minutes to make sure the skin is not too red, as that can cause a burn. The third part of R.I.C.E is compression. There are a couple different methods that can be used for compression, such as using a tensor bandage, or use of an ankle brace, or use of a compression sleeve. These different devices can be found either at a pharmacy most commonly, or at a department store. The fourth part of R.I.C.E is elevation. So again, pain and swelling are on the outside here. And so swelling, generally, everything drains out towards the heart. So in order to drain swelling from the ankle, you want to elevate the leg above the level of the heart. So you want to have a nice angle, just like this. So the person would be resting in this position, and then just naturally, because of gravity, everything would drain this way. And the heart's up that way. She's lying down, and her heart is below the ankle. And so resting in this position as well, combined with the rest, ice, and compression, and elevation. R.I.C.E principle is not meant to be done individually, so R.I.C.E can be done in combination. So rest can be combined with elevation, and the ice can be combined with decompression. So just remember, with a recent injury, remember the R.I.C.E protocol: rest, ice, compression, and elevation. I'm Castra, and this is Ashley. If you'd like to book an appointment, remember medrehabgroup.com.